What up, everyone? Sorry, it's been a while since my last video. I've been a little busy studying for my dental board exam here, and so all the free time I used to have, I'm kind of devoting towards that. Still going to make an effort to come out with a video every week, updating you guys on my current situation, what's going on in terms of medical professionals, orthopedic surgeon advice, what my physiotherapist is telling me, and just compare yourself to like my range of motion. And I know how much benefit there is to come when you have someone going through the same rehab process as yourself, and you can kind of see their progress in a certain timeline. That being said, if you guys are getting value from this content, I just ask that you like and comment below. Shows me that I'm not just uploading these and talking to myself, and that I'm actually helping people out there. All right, guys, so just a couple updates before we get into the video. I want to discuss today what was said in my 6-week follow-up consultation with my orthopedic surgeon. I'll discuss what was said in the phone call with Dr. John Petrizzo, who is my physiotherapist moving forward when dealing with this injury. Can't say enough good things about this man. Professional, super courteous, took time out of his day to call me and pretty much lay out my next 6 weeks for this rehab process. Went into detail with the reps, the intensity, the tempo, what needs to be done, what can't be done, what I should stay away from initially, what I can start adding to as the weeks progress. Very helpful man, and I'm glad that I found him and that I reached out and he was able to take time out of his day for me. So let's just get right into it. I started running again. I have no excuse now to do some cardio. The weather is still a little bad here where I'm from, and by bad I just mean uncomfortable. I can run in it. I'm just being a princess. Just gotta bundle up and wear enough clothes for the condition. But part of the reason why I like running, or like running outside, that is, I don't enjoy running on a treadmill. Back when I was fully operational and I had no injuries, my cardio usually came from hitting a heavy bag. I found that it was a perfect mix of high intensity. I didn't get bored, and so I think that's the one major hurdle for cardiovascular training is not getting bored in the amount of time it takes you to do it. The best form of cardio, one in which you are enjoying doing it. I like running outside, usually first thing in the morning on an empty stomach after I have my cup of coffee. I feel like you layer on the benefits by doing that. So first thing in the morning, you get the light stimulus your eyes need in order to inhibit the cortisol and melatonin production that is naturally occurring in your body. So it sets you up for your circadian rhythm to be regulated for the rest of the day. It also gets your steps in first thing in the morning. Don't need to worry about that. I try to aim for anywhere around 10,000, 15,000 a day. And lastly, by doing it on an empty stomach, you hit levels, or you hit metabolic functions in your body that you would not normally do in a fed state. And you pair that with a type of run. So for me, I've trained in the Maffetone method, which is basically a heart rate targeted run. And so the Maffetone method, it caps out your heart rate, which in order for you to do that, you have to limit your pace. And so the ideology behind that is you don't want to reach a heart rate that puts you into zone 3 or above. Basically, you want to stay in zone 2. And if you've done research on cardiovascular endurance training, zone 2 is where you get all of the aerobic benefits, meaning you pull from your adipose tissue or your fat cells so that you aid in weight loss, and also in partitioning where you pull your energy from. Most of us now are very glycolytic. We always need that burst of glucose in our system in order to have and feel energetic. And so Maffetone method training, fasted, helps bring back up that aerobic, fasted state of energy withdrawals. Take that as you will. For me, I find that it works really well because it also doesn't require a bunch of recovery since the intensity is low. And so I can stack it with my weight training that I would normally do later on in the evening. So I went on a couple runs. The weather here isn't the best, and so it is still a little cold, as you can see from these videos. I don't have necessarily trail running shoes, and so I was just using road shoes on these icy paths. As you can see, I was a little worried. I was thinking to myself at one point, if I were to biff and slip on any one of these ice patches and I were to re-injure my arm, I would be the biggest idiot in the world. I would erase 6 weeks of rehab. I wouldn't even be able to look my orthopedic surgeon in the face, because he's the one telling me that I should lay off most physical activity. Actually, all physical activity. He didn't want me doing anything for the first 6 weeks of this, as most of you have probably heard from your orthopedic surgeon if you're going through the same injury. But yeah, so I was very cognizant of that when I was going on my run. I went for a run with my dog, and he's still just a pup. He's only 10 months. And so we're training him how to run alongside someone off leash. And so there are times when he's cutting you off, no signals, no shoulder check, and he just clips your feet at times. But and so that was also a little hurdle, a little danger in the run. But I survived. I made it out, no injuries. And so getting into the conversations I had with my orthopedic surgeon, kind of had an idea of how this was healing. I felt my tendon, I can see my muscle move when I supinate, so everything seemed to be fine. Barring any specific traumatic injury in between the 2 week and 6 week mark, I don't think my orthopedic surgeon is going to tell me anything that I don't already know. But I was there. I didn't expect the 1.5 hour wait. But in hindsight, if someone told me that I'd have to wait 1.5 hours to see my orthopedic surgeon for him to tell me that everything seemed to be going good and I'll see you in another 6 weeks, would I do it again? Probably not. But we had a good conversation. He told me the wound was healing nicely. He palpated the tendon, said that it was attached. He told me that I could now start loading this side very lightly. I agreed. I said, okay. And he told me that I should still abstain from any type of sport. So I don't know why I asked him, but as soon as he saw me, he's like, okay, now you have the green light. Your physiotherapist will get you to start with isolating that bicep with light weight, and you can work with your range of motion, increasing it every so often, blah, 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 blah. And then I asked him, I'm like, okay, well, now that I have the green light, and you're telling me that it is now supra-physiological, can I start with some light activities? And he's like, what do you mean? I'm like, can I start playing golf? Can I hold pads for my friends when it comes to boxing? And he's like, oh my God, I'm so sorry. I've totally forgot to mention, no sport for the next 6 weeks. So just rehab. And he's like, I'm sorry, I forgot to mention that. I should be more specific, especially when it comes to you, if someone who seems to be very active. And we joke because during my 2-week consultation, I asked him whether or not I would be allowed to go on runs and work. And he's like, no, your job right now is to rehab this, bed rest. And so we still joke about it today whenever I see him. But yeah, no sport on his recommendation, slowly rehabbing it with my physiotherapist, and come and see him in the next 6 weeks, which I don't know if I'm going to do. From this point on, most likely not. If I have to wait another 1.5 hours, 2 hours for him to tell me everything is okay. But we'll see. We'll cross that bridge when we get there. The day after my 6-week follow-up, I had a phone call scheduled with Dr. John Petrizzo. And so if you guys are doing your research online and following along with other people here in YouTube who have healed their distal bicep tendon, you might have heard this name before. He's a great physiotherapist. He has helped other active individuals heal from this type of injury with his own form of rehab, which kind of diverges from your typical physiotherapist's guidelines. And so for the next couple of videos here, I will be uploading his rehab schedule, but in summary, I'll let you guys know what was said in the conversation. So basically, he laid out my next 6 weeks in 2-week increments. And he mentioned in detail the reps needed for each set, the intensity, so basically how much energy or how many reps in reserve I should have at the end of my set. And he also outlined the tempo of each rep. And so he doesn't want you to be jerking the weights around. He wants kind of a slow, sustained eccentric and concentric motion, a pause at the bottom at the top of each rep, just to prevent any momentum shifts that can have some sort of impact on the muscle. And his ideology that differs him from most other guidelines that physiotherapists will probably give you is, instead of isolating the bicep and rehabbing it slowly with light weight and then putting compounds in afterwards, he wants you to start with the compounds and have the bicep be activated through secondary movements. And I agree wholeheartedly, completely. I think there's more benefit for your body, not only for your bicep, by doing compound movements. And you're not jumping in there trying to hit like a 1 rep max immediately with that compound. You can start slowly. And I'll start filming videos of myself in the gym. I've done 1 workout so far. I didn't have my filming equipment with me, and so I didn't. But I started out with the bar and I went up in 10-pound increments. 20-pound increments on each, 10 pounds on each side. And I got my way up to maybe a plate. I think I started noticing around 35 pounds a side. Around rep 5, I was getting a little bit of fatigue, especially in my shoulder area, just from non-use. And so you guys are going to notice that, if anything, of staying away from any exercise or any movement when you're jumping back into it, you're not going to have discomfort in terms of pain, whereas you're more so going to have noticed it in terms of fatigue, just because the muscles haven't been used. They've been dormant for a long time. And so firing it up again will give you that feeling of just being untrained, basically. And so for the first 2 weeks, it's pushing movements, it's bench press, barbell bench press, it is barbell shoulder press, it is tricep extensions with the cable, again, minding your tempo and minding your weight. Don't try to ego lift. And this is something that I noticed with my first push day. I was working out with a friend, and you know, they say you should check your ego, leave your ego at the door when you're stepping into a weight room. Well, in terms of rehabbing this injury and jumping back into your first push workout, leave your ego at home. Not even at the door of the gym. Leave it at home. Don't bring it into the car ride over. Leave it at home. There's going to be a point in time, which happened to me, where I was shoulder pressing with the barbell and felt good, felt comfortable. But I knew that I wasn't going to get much more weight on the bar from that. But still, progressive overload, work your way up to a 5 rep where you feel it. And for me, that meant putting 5 pounds on each side. And
okay, so we're gonna do a little lift-off competition here. Come on, 3. 1 more, you can do it. Oh, he's going for 5.
By putting 5 pounds on each side of the barbell, when you have girls on either side of you hip thrusting, squatting, plates on theirs, and having them look at you is definitely a gut check and makes you feel some type of way. And having a workout partner that strips your 5 pounds off and puts on like a 45-pound plate onto his insult to injury. But just remember, you're rehabbing an injury, and so, you know, silence all the haters. You're doing this for yourself. But hopefully when you're in that phase and you're putting that weight on that bar, you know that you're not alone. There is a solidarity. United we stand, guys. United we stand. And yeah, the next couple of videos here, I'll discuss what was said or what was described to do in the next couple of weeks. So weeks 8 to 10, basically allowing you to start bilateral pulling movements, so pull downs, rows. Weeks 10 to 12, start deadlifting and squatting, starting with high bar squats as opposed to low bar. And hearing that over the phone kind of struck that chord, deadlifting. I'm like, am I allowed to do that again? You have a little bit of PTSD deadlifting. I remember asking, I'm like, should I start with a hex bar? Or should I start with this? And he's like, no, you should be able to jump back into it, albeit lightweight. And so we'll see how I feel. That's still 4 weeks away, a month away. So I'm sure that from my progress in the last couple of weeks, if it's anything like that, the same rate for the next 4, I should be fine. I mean, 2 weeks ago, I was barely holding a cup of coffee. Now feel like I'm Superman. And a lot of it is the positive reinforcement that I got from my orthopedic surgeon and from Dr. John Petrizzo. And so a lot of it, I feel, is mental. The tendon didn't solidify and strengthen within that one day of me not hearing these words. But got to take that into consideration. So here's the x-ray that I got from my 6-week follow-up. Oh, sorry, no, not this one. That's a different x-ray. Here is the x-ray I got from my 6-week follow-up. And there's 2 different images here. You can see the endo button, the small radiopaque image on the outside of my radius there. And you can see the radiolucent area on the radius where the bone was drilled out. So basically bone is radiopaque, meaning that on an x-ray image, it'll show up as more white than black. And if there's soft tissue or if it's blood or if something is empty, meaning that there was, so for instance, a hole drilled out, then it'll be a little bit more black, so radiolucent. You can kind of see where the endo button is. Just next to it is radiolucent because that's where they dug or tunneled the hole in order to insert the tendon. And so my orthopedic surgeon told me now, 6 weeks from the 6-week mark, I am technically supraphysiological, meaning that my tendon should hold stronger than prior to the injury. But he also reminded me that during my surgery, and I'm not sure if I mentioned this in my other video, but during my surgery, when he opened up my forearm and went to go fish for the free end of my tendon, he was expecting to see a nice, clean, acute ruptured tendon that is usually the case with this type of injury. But what he found was that my tendon was a little bit, and in his words, ratty, like a ratty tendon, meaning that it was kind of beat up. It wasn't nice and clean, fresh off the bone. And so his 2 thoughts, or his 2 reasons to why that could be, were 1, that I injured my tendon in the past and time frame unknown, but that I worked through the injury. It wasn't a full tear, but I worked through the injury, recovered from it, strengthened the muscles around so that it seemed like there was no injury, and that I was back to functioning. Or 2, his other theory was that slowly over time, break it a little bit more and more and more, meaning that when I tore it that day, it was the straw that broke the camel's back per se, and that it was a tear that would have been inevitable.
I am inevitable.
Because of the condition of my tendon. And so he told me that without having an x-ray, the chances of that being the same on the other side are higher than normal, barring any injury in the past, which I think if I can't pinpoint a specific day and time, but I do remember a period where I laid off of bicep curls because I found them uncomfortable. And this was early on. This was like, I'm talking high school days. I think I was curling more than I should have on a preacher curl, and I think I injured my arm then. And like, I think that's the only time I could think of where this could have happened. And then I laid off of pulls and curls for a couple months because it was bringing me discomfort. I didn't seek help, didn't get an x-ray, didn't think anything of it because it wasn't as bad. It was a partial tear, if that. And so I worked through it. And so I'm thinking if there's a point in time in my lifting, then that would have been it. And so that could be the reason why the tendon is a little ratty. And so if you look at the x-ray here, you can kind of see that in the area where the tendon is in the bone, that is all fine. If there was going to be an incidence of re-rupture, it wouldn't be there. It would be at the area outside of the bone that is technically weaker due to the past injury or the degeneration over time that my orthopedic surgeon has spoke of. And so still have to be aware of that. And he emphasized that warm-ups are crucial, especially now post-injury. Definitely warm up the arms, the tendons, the biceps on both sides. And so I mentioned in my other video that is now just a part of my routine. And so that's pretty much it, guys. I will continue uploading videos, following along my workouts. My next video will show probably my push workout, the reps, the exercises, how I'm going about it. And we'll see you guys on the next one. Take care.